Hi there. I'm so glad you're joining me today. Before we see our patient, let's talk about how to prepare for an occupational therapy evaluation in the hospital. Preparation is key to ensuring we gather all the necessary information and provide the best care possible. Are you ready? Let's get started. This is the Occupational Therapy Initial Evaluation Form. It will guide us through the process step by step.
This is the evaluation form. This is a critical document used to assess a patient's current functional status, set therapy goals, and plan interventions. You will notice that many sections allow you to circle the appropriate option, and there are also comment sections where you can provide additional information as needed. By the end, you should understand how to navigate the form and how each section contributes to a comprehensive patient evaluation. Remember, you do not have to follow the order of the evaluation, as you can choose which section to start off first depending on the patient. The first section includes general patient information such as the patient's name, past medical history, admitting diagnosis, and any precautions that need to be taken. These details help guide the evaluation and ensure the safety and appropriateness of therapy interventions. The next section is Cognition Assessment. This section evaluates a patient's mental status, including general alertness, orientation, ability to follow directions, safety awareness and attention span, and communication skills. You can ask an example question such as, "Can you tell me your full name and where you are now?" Next is Social Functional History and Home Environment. Understanding the patient's living situation and social support is essential for planning interventions. This section includes living arrangements, where they live alone, with family, or in a facility, home environment, house type, number of floors, accessibility features, existing home equipment, including assistive devices like walkers, wheelchairs, or grab bars. Prior level of function details the patient's ability to complete daily activities before their current condition, and any hobbies. This helps guide therapy to align with the patient's personal interests. Then is Vision and Perception. This section assesses visual abilities and perception. It includes basic vision screenings, ocular range of motion, neglect or field deficits, and any recommendations for vision consultation. Neurological Musculoskeletal Assessment. This section focuses on MMT for upper extremities, grip strength and pinch coordination, sensation, proprioception and coordination, presence of tremors, tone abnormalities or edema, hand dominance, and functional implications. Here you'll use your clinical judgment, and you will include if they're within normal limits or if they need any assistance. Next is Activities of Daily Living Assessment. This section measures the patient's ability to complete daily self-care activities, including eating, hygiene, dressing, toileting, and bathing. Levels of independence range from independent to total assistance. ADL mobility and postural control includes sitting and standing balance, both static and dynamic. In the comment sections, you could write in which position and where were the ADLs done. Pain and endurance includes pain assessment and endurance assessment, which evaluates how well a patient can sustain activities. Remember to notify a registered nurse if there is any pain. Assessment and treatment plan documents the therapist's professional assessment and outlines a treatment plan, including potential limiting factors, frequency of therapy session, types of treatments prescribed. You could circle which ones are appropriate. On the assessment section is where you write your SOAP note. Next, for discharge recommendations and equipment need, based on evaluation findings, the therapist recommends next steps: referrals to other services, discharge destinations, and equipment needed. An example question could be, do you feel safe at home, or do you think you may need any equipment to help you? In conclusion, this form serves as a roadmap for occupational therapy interventions, ensuring that therapy goals are patient-centered and evidence-based. By thoroughly completing each section, therapists can develop a treatment plan that maximizes patient independence and quality of life.
Let's quickly go over what we need to know before we walk into the patient's room.
Using your initial eval sheet, pause the video to jot down crucial information. We need to review the patient's medical chart. Look for their admitting diagnosis, precautions, and past medical history. This information helps us understand why they're here and what to keep in mind during our evaluation. For example, if a patient has weight-bearing precautions, we need to make sure all our activities follow those guidelines.
Although the evaluation form has a structure of the information needed, it is also helpful to jot down a few key questions to guide your evaluation. For instance, I'll be asking about their home environment, support system, and what they could do before their hospital stay. This is their prior level of function. Lastly, think about how you'll approach the patient. Remember, being friendly and professional sets the tone for a productive session. We want the patient to feel comfortable and confident in our care. All right, we have our form, our questions, and a good understanding of the patient's background. Let's head to the room and start our evaluation. Are you ready? Let's go. Let's meet our patient, 24-year-old Ria. She was admitted with a left knee sprain and has specific precautions to avoid strenuous, weight-bearing activities and prolonged walking or standing. Be sure to have your initial evaluation form ready. Use it to circle or check off or write down important information as we go. Feel free to pause the video whenever you need to complete your form. Keep in mind that every facility and practitioner has their own approach to the evaluation, and it takes time and practice to find your own style while understanding the specific forms used in different settings. For today, we're keeping it simple. This will be a basic evaluation to help you get familiar with the form and the process. Ready? Let's get started.
Come in.
Hi, my name is David. I'm your occupational therapist today. We're gonna go through a quick evaluation. Is that okay?
Sure.
Okay, I'm just gonna ask you a couple questions before we start.
Okay.
What's your name?
Rhea Ripley?
Okay. And do you know where you're at right now?
Yes, I'm at the hospital.
Yes. Okay. And do you know what year it is?
Yes, it's 2025.
Okay. And do you know why you're here?
Yes, for a knee injury.
Okay. Yes. Yes. Okay. So, like I said, my name is David. I'll be your occupational therapist. Have you ever had occupational therapy before?
I have not.
Oh, okay. So, occupational therapies is working with patients to help them get back to their activities of daily living,
Okay.
such as going to the restroom, getting dressed, all those things that make you you and help you be independent.
Thank
Okay?
you for explaining.
Yeah, of course. So, I'm just going to ask you a couple questions here. Who do you currently live with?
I currently live with my husband.
Okay. And is it a house, apartment?
Yes, it's a one-story home.
Okay, one-story home. Okay, perfect. And for your shower, is it a tub shower or a walk-in shower?
It's a walk-in.
Walk-in, okay. And for your toilet, is it a standard toilet or a raised toilet?
It's standard.
Standard, okay, thank you. And for your home equipment, do you have any front wheel walkers, single point canes, wheelchairs, anything like that?
No, none of those.
Okay, perfect. Okay, and prior to coming to the hospital and your injury, of course, would you say you were independent with all your activities of daily living when it comes to showering, getting dressed, eating?
Yes, all completely independent.
We completed the first part of the evaluation. I was following the initial evaluation form to make it easier and so you guys could follow along. Feel free to create your own questions so you can build a rapport with that patient. We will move on to the next section. Is there any hobbies that you like to do prior to your injury?
Yeah, I'm really into running. Sometimes I like to go golfing with friends.
Okay.
Yeah.
Okay. For this next section, I'm gonna need you to sit at the edge of the bed. Is that okay?
Yeah, I could try.
Okay. Go ahead. I'm just gonna do some quick assessments on your eyes, making sure everything's okay. I see you wear glasses. Do you wear them every day?
Yes.
Okay. Okay. Now I just need you to go ahead and follow my pen. Okay. Okay. Thank you. Okay. Let me know when you see the pen. Ready?
I see it.
Okay. Okay. Hold your eye still. Let me know when you see it.
I see it.
Okay. Thank you. Okay, now I'm gonna test your range of motion and muscle strength on your upper body. Is that okay?
Yeah, that's fine.
Okay, so I'm just gonna need you to raise your hands up as high as you can. Good. Now touch your head, your neck, behind your neck, shoulders. Okay, now spread your arms out. Now in front of you. Okay. Now can you reach behind you?
Sure.
Okay. Now, can you reach towards this knee? And the other one? Okay, good. Thank you. Now, can you put your arms straight out? Okay, hold it there. Don't let me move you. Okay, can you bend your hands like this? Hold it there. Don't let me move you. Okay, hold it there. Don't let me move you. Okay, can you put your arms out again? Wrist down. Go ahead, don't let me move you. Okay, again. Now wrist up. Don't let me move you. Don't let me move you. Okay. Seems like everything's intact for your upper body. Do you have any issues or any complaints about it?
No, everything is okay.
Okay, so it would be mostly your knee, correct?
Yeah, my left knee.
Okay. Now, you do have precautions. Do you know what they are?
No, they haven't gone over it with me yet.
Okay. So, according to the chart, some of your precautions is to avoid strenuous activities such as walking too much or standing for long periods of time.
Okay.
And that's about it.
Okay, not too
Okay.
bad.
Do you have any pain right now?
It comes and goes.
Okay, on a scale from 1 to 10, 10 being the worst, 1 being no pain at all, what would you rate it?
I would say at worst I'm a 7.
A 7?
Yeah.
Okay. Now remember, once you get the flow of the evaluation, you could start from wherever you want and you could ask whatever questions you want that pertain to the initial eval form. Okay, and are you right-handed or left-handed?
I'm right-handed.
Right-handed, okay, thank you. Now I'm going to be testing your opposition, your grip, and pitch. Is that okay?
Mm-hmm.
Okay. So, can you squeeze my hands?
Sure.
Okay. Can you use these 2 fingers? Squeeze it. Thank you. Okay. Okay, and do you have any sensation issues or anything like that? Upper body, lower body, everything's intact?
Yeah.
Okay. Okay. Any swelling on anywhere?
Other than my knee?
Yeah.
No.
Okay. Once you get a sense of your patient and you see how they're doing, you could easily start checking off things on the initial eval that just make sense. For instance, the patient seems well, has no tremors, and only has swelling on the knee. So there's no need to do any initial assessments or testings for other things. Now we're going to move on to ADLs. At times, it's okay to do simulations with ADLs, but if you're able to complete all ADLs, it would be better, not only for you and your evaluation, but for the next therapist that will see the patient. For learning purposes, we are going to pretend she is showering. I need to test your ADLs and see if you are independent or need some assistance throughout the whole process, okay?
Okay.
Okay, so we're gonna start off with showering. I understand you do have precautions to avoid strenuous movements and standing for too long. So for that reason, we're gonna do it seated. Is that okay?
Okay.
Okay. So here is the sponge. And the water is right here. Let me know if you need anything else, okay? I will be right here if you need any assistance.
Okay.
Okay, go ahead.
Okay.
Now, using your evaluation form, go ahead and write down what assistance was needed for upper extremity bathing and lower extremity bathing. If it is not there, go ahead and write it on the comment section. The comment section could also be used to write what position and where the ADL was done. Rhea, now we're going to put on our clothes, okay?
Okay.
I will be here if you need any assistance or go ahead. You okay there?
Yeah. It's a little hard, but I think I could do it.
Okay. Good job.
Thanks.
Go ahead and mark down what type of assistance was needed for upper body and lower body dressing. As you can see, the clothes was placed on the bed and the occupational therapist was standing there just in case she needed help. Hey Rhea, now we're gonna go to the restroom to do some grooming and toileting if you need to use the restroom.
Okay.
Go ahead and mark down the type of assist level you think Rhea needed when it came to grooming and toileting. Seems like Rhea was independent with toileting and hygiene, as she was able to independently walk to the restroom with no adaptive device or equipment, and she was able to independently brush her teeth, wash her face, and use the toilet, donning and doffing her pants, and grabbing the toilet paper to clean. Okay, Rhea, it seems like you're doing pretty well. Do you have any pain so far?
No, everything's feeling pretty comfortable.
Okay, seems like your food is here. Do you need any assistance in eating?
Do you mind just handing it to me?
Of course.
Thank you.
Seems like Rhea is fine with eating, so you could check off independent for eating. Is it okay if you sit here at the edge of the bed and eat?
Yes.
Okay, perfect. Everything seems well so far. That concludes our initial evaluation. Do you have any pain right now from a scale to 1 to 10?
I would say with medications like a 4.
Okay. Okay, we'll keep monitoring you, see how you're doing, and see if you will still require occupational therapy.
Okay, thank you.
Yep. And that concludes our initial evaluation. Use your clinical judgment to determine what type of assistance was needed for the ADLs, MMT, range of motion, and if they will require any additional occupational therapy while they're in the hospital. Remember, every person is different, so every evaluation will be different. To conclude your initial evaluation documentation, you will be required to write a SOAP note on the assessment area. Remember, write your S, O, A, and P. You've done an amazing job today. Together, we learn how to complete an OT evaluation step by step. Remember, every patient is unique, and this form helps us to provide the best care. Thank you for joining me. See you next time.